Being nominated by my peers makes me feel really important and recognized for things that I do every day. As a consultant, you don't have patients of their own, so if a surgeon or a subspecialist nominates you, that means that they trust you with the care of their patients, and they respect your medical knowledge. They respect that you understand the needs of their patients, especially of their surgical patients, and they really value your input into the patient's care. I actually take over all of the medical problems, so if a patient is referred to me to get their hip or their knee fixed, we take over their medical, so everything except for their hip and knee, so their heart, their lungs, their liver, their kidneys, their psychiatric health, their everything, their needs, to make sure that things will go smoothly. If they need help with being referred for placement, if they need help for getting home health, those are all kind of in my realm of expertise. And then right before they'll go home, I'm like, I'll give them one more double check to make sure everything looks good, like their blood pressure, their blood work, all their numbers and everything look good. And if there's things that are not quite finished, like I ordered a test and it's not back yet, or if I cut back on their medicine because their blood pressure was low, I'll tell them, and sometimes I'll even call the family doctor and say, hey, I did this, I need you to check up on them in a week or so to make sure that everything looks good. So it's definitely a full circle, and the patient is the center of everything. I feel blessed and honored and respected by us. There's so many good physicians and nurses and support staff and secretaries and medical assistants and nurses that really help everything move smoothly. So to be singled out, I feel really honored.